family crisis happening in America today, and we're going to solve it.
That's my issue. It is. Senator, good to see you tonight. Thanks so much.
Thanks, Ed.
Senator Tom Harkin of Iowa. All right, now I've said that the GOP has no health care plan. Now let's be fair about this. But a Republican congressman named Tom Price has actually put forth a plan for market-based health care systems. All right, now here he is to tell us about it. Congressman Price, he's also a medical doctor who's practiced orthopedic surgery for the past 2 decades. Dr. Price, thanks for joining us. Congressman, thank you for joining us tonight.
Great to be with you.
I read your piece in the Politico, and it just seems to me that you really make the government out to be the boogeyman, and I just have to get some clarification. Should the government have any involvement in health care reform outside of Medicare as we have it today?
Well, I think I agree with the American people, and that is that we don't want to put the government, we don't want to put bureaucrats between a doctor and a patient. That's the concern that I have, and so many individuals across this land have. We will have a plan that makes it so that we have patient-centered health care. You hear all sorts of talk about market-based, consumer-driven. That's not what the issue is. The issue is whether patients and their families, along with doctors, are going to be able to make health care decisions. If we insert the government between the patient and the doctor, that's not where the American people want it, and that's the concern that we have about the proposals, frankly, that are being talked about from the other side.
Well, Congressman Price, the one thing that we do have in between the patient and the doctor right now is an insurance bureaucrat who's raising everybody's rates and nobody's reeling them in. What's the Republican plan for doing that?
And you're right, and that ought not be as well. But the solution to all of this is to make certain that all Americans have health coverage, that they have health insurance, and that health insurance is owned and controlled by the patient or his or her family. You've heard the old saying, the golden rule, the usual golden rule. But the golden rule here in Washington is that he who has the gold makes the rules. And if we allow Washington to make the rules, then what will happen is that we will insert a bureaucrat between patients and doctors, and we ought to empower the patient.
So I think we have some common ground here, Congressman, in that you agree that it's not patient and doctor. There's somebody in between. Right now it's the insurance companies and the CEOs and all that stuff. Now, you made the comment, how are we going to get everybody covered without government involvement? People that can't afford premiums right now, what are we going to do to get them covered?
Well, you got to have government involvement. Government's involved in everything, but the government involvement ought to be empowering patients. And the way that we do that so that patients and families have real power in the health care system is to make it so that every single American can afford to purchase health insurance regardless of their station in life. And you can do that through deductions or credits or refundable credits or advanceable refundable credits up and down the economic spectrum. Every single American needs to be able to look at the end of the day and say, it makes financial sense for me and my family to have health insurance. Once you do that, then you solve all sorts of problems because you empower patients and their families, along with doctors, to make those health care decisions instead of government bureaucrats or a government takeover, which nobody truly wants.
Well, actually, there's a lot of surveys out there that show that single payer is very popular, but that's another subject. I want to focus on the Republican plan. I'm curious, did I just hear you say that you admit that the government needs to be involved to get these 50 million people who aren't covered? Are you talking about a mandate?
Talking about tax policy that makes it so that when Mr. and Mrs. America sit out there at the end of the day at their kitchen table and they do their finances and they do their budget, that whatever support, premium assistance, call it what you want, occurs from the federal government, that it makes financial sense for them to have health insurance, health coverage. That's the only way you get to the solution in this. We've got to make certain that everybody has access to appropriate quality, high quality health care coverage. The other system won't work. It's important to appreciate that European systems and Canadian systems have a lower quality of health care when you look at disease-specific problems.
Well,
that's not what we want to do here. We don't want to repeat the mistakes of Europe.
Congressman, I have to challenge you on that. That simply is not true, that the Europeans and the Canadians have just the kind of quality that the United States has. And they put money into research and development just like the United States has, and in some areas of health care even more.
Oh, Ed, I need to take issue with that because it's extremely important.
Well, it is important.
There are 5 cancers in the United States that have a cure rate of over 90%. There's only 1 cancer in Europe that has a cure rate of over 90%.
But when it comes to heart disease, that's not the case. And when it comes to diabetes, that's not the case.
Not true. If you look at
that is true, Congressman.
If you look at disease-specific treatment, now if you take the whole ball of wax and you add certain things that the World Health Organization adds that are truly extraneous to disease treatment, then you get different numbers. But if you look at who survives heart attacks in this nation and who survives elsewhere, who gets coronary artery bypass procedure and who doesn't in Europe, there's a huge difference.
Congressman, we're one of the fattest countries on the face of the earth. Health care and heart disease is treated not as well as... I can't believe you're saying that, but I respect what you're saying.
Do you think the federal government is going to be able to solve obesity?
You know what, Congressman? I think that Medicare works for over 90% of the people with no complaints in this country, and I think that if we were to extend that, and I think if I could bring you into this line of thinking, this is what the American people want to try. They want an extension of Medicare, and they're willing to pay for it.
Ed, tell me why the Mayo Clinic is now limiting the number of Medicare patients that they're seeing.
The Mayo Clinic...
Why are doctors across this nation limiting the number of Medicare patients?
Sir, a recent survey shows that the healthcare providers at the Mayo Clinic are for major reform, and the majority of the healthcare providers at the Mayo Clinic, they want single payer.
What they want is the ability to treat their patients. Now, what they want is the ability to treat their patients. I would suggest respectfully that if we insert the federal government between patient and doctor, that they will not be afforded that privilege of being able to treat that patient.
Doctor, you have to admit this. On Medicare, you can go to any doctor you want. You have choice. Is that correct?
You can't even find a doctor now that takes Medicare because of the system, Ed.
That's because we haven't made the commitment the way we want to, but the system is in place, and also their administrative costs are much lower. Congressman, I've really enjoyed this conversation.
Ed,
I appreciate you coming on. I want to continue this dialogue. I want the Republicans to have a plan. I want us to get health care going.
We got a plan, and it's patient-centered. That's the key, patient-centered.
All right, and the cost is going to go down, right? I can hold you to that. All right. Congressman, great to have you on with us. All right,
Thank you, Ed.
You bet. Coming up next.